Elizabeth here from Psychiatric Wellness, and I wanted to talk to you today about what it is like to be a new patient at Psychiatric Wellness. So, to become a new patient at Psychiatric Wellness, I highly recommend that you go to our website, which is psychiatricwellness.org, and kind of take a look around and kind of see what you think about the services that we provide and kind of our approach to mental health treatment. We do practice integrative psychiatry, which that means we kind of look at we don't just prescribe medication to treat symptoms. We kind of try to look at root cause to see, if maybe there's physical or environmental factors, social factors that could be contributing, to the symptoms that you're having. So we try to treat the whole person. Um, so prior to your initial visit, we would ask that you fill out intake paperwork, which the intake paperwork is very extensive. Um, does ask a lot of health history and things like that. And that, again, is because we're an integrative psychiatry clinic. So we try to look at all those factors. We do actually look at the paperwork before you come in. So don't worry about that. I know at some places you might fill out paperwork and then you come in to see a provider and they're just asking you all the same questions. And that's not what we do. Before you come in, the provider spends 1 to 2 hours looking over the paperwork. They develop a summary and a tentative plan, based on what you filled out. So that paperwork is very important. During the initial visit, we do take longer with you than you would get at most psychiatry clinics, usually an hour to an hour and a half. And what we do is we review that summary that the provider created for you and the tentative plan that they created for you and see if any alterations need to be made, maybe clarify some information. In addition to that, generally the provider will, want to do genetic testing in case medications are needed. Or even, if you don't want to use medications, there are some other genetic things that those tests check for that could be contributing to anxiety and depression that, could possibly be treated, even just like with a specialized supplement. So we do like to do those when we can. A lot of insurances do pay for the genetic testing. We also do pretty extensive lab testing where we're checking, for some hormones. We also check for some nutritional deficiencies, inflammatory markers, and things like that. Things that if they're off, they can definitely negatively contribute to mood. So those are some things that would be definitely discussed at your first visit. The other thing that would be discussed, would be, are you wanting therapy as well, or just kind of some recommendations, like maybe for lifestyle, maybe, to continue some medications and things like that. We do recommend therapy as a part of everyone's treatment. But some people may come to the clinic and they're already seeing a therapist, or, maybe they're just not ready to do the therapy portion of it as of yet. So that would be discussion as well, that first visit. For follow-up visits, it kind of just depends on what you are wanting. If you do want therapy as well, usually we follow up in a week. Generally, labs won't be back by then, but you would kind of start developing that plan for therapy with your therapist and maybe kind of start on some history taking and things like that. If you are just kind of doing medication and lifestyle management, usually follow-up is in a couple of weeks, and that gives enough time for the labs to come back so that those can be reviewed with the provider. Those follow-up appointments, generally your first one, maybe 30 to 45 minutes. And then thereafter, for just medication and lifestyle management, it kind of depend on, how intensive we were needing to manage those things at first. For still adjusting medications, it could be like every couple of weeks for a while. But once things kind of get more stable and things like that, generally we go out to maybe once a month. And then if things become pretty routine, maybe about every 3 months after that. And if you have more questions after kind of looking around on the website and kind of looking at this video, definitely feel free to call the office. We have a very good intake coordinator who's happy to answer other questions. And the main number to the office is 405-437 2235. That's 405 437 2235. Look forward to hearing from you.